Hello, everyone. My name is Tiffany Thomas, and I'm the Program Manager of Education and Outreach at the Mental Health Association of Maryland and a co-coordinator of the Children's Mental Health Matters campaign. You can visit our website at www.childrensmentalhealthmatters.org. I'm super excited to be with you here today to talk about why children's mental health matters and how you as a parent or caregiver or as a caring adult can support a child's mental health and well-being throughout their entire life. So let's go ahead and jump in and get started. So just a little bit of history about the Children's Mental Health Matters campaign and our goals with the campaign. Our campaign is a collaboration between two different organizations, the Mental Health Association of Maryland and the Maryland Coalition of Families, and we receive our support from the Maryland Department of Health Behavioral Health Administration. The campaign has been collaborating efforts with many partners and organizations since 1996, so for more than 20 years across the state. And our goals are to increase public awareness around the importance of children's mental health and substance use, to reduce stigma surrounding mental health, to connect children and families with resources for prevention and support of mental health conditions, highlighting creative and innovative efforts of local communities in Maryland, and providing opportunities for all of our partners and school and community champions to be a role model for children and youth across the state. So we do have many partners that we work with, but these are our partners that support our efforts mainly across the state. I did mention Maryland Department of Health. That is a huge support for our campaign, but we do collaborate and partner with the Maryland State Department of Education, Maryland Department of Disabilities, MANSEF, Maryland BHIP, and the National Center for School Mental Health. So our campaign really focuses on how critical children's mental health is more now than ever. And I'll touch on that in just a minute. But by equipping adults, caring adults with the resources and understanding of why children's mental health is so important, we all have an opportunity to make a change in a child's life. And so we do that through our partnerships with schools and community organizations across the state and provide them with resources to help engage and support our families across the state. And by doing that and giving the tools and resources to families, we hope that our children across the state will go on to be more mentally well and healthy. So why is children's mental health so crucial and urgent now? Well, if you haven't noticed, for the last 2 years, we've all been living in the middle of a pandemic. And in October of 2021, a national emergency was declared in child and adolescent mental health. And during the COVID-19 pandemic, 1 in 4 children, compared to the statistics before the pandemic, which were 1 in 5 children, are experiencing a rise of depression, anxiety, trauma, loneliness, suicidal thoughts, or acting on suicide, substance use, and that will have a lasting impact on them, on their families, and their communities. And this is happening in your community, maybe has happened in your family, and has happened all across the state of Maryland. So now, 1 in 4 children are experiencing a surge of mental health conditions. And so that is a 20% increase of children and youth facing mental health or substance use challenges, which is why it is so urgent that we continue to do what we can to learn about how to support children's mental health, and that we are also role models to take care of our own mental health in our homes, in our schools, in our communities. So what is mental health and how do I explain this to my child or to any child? So let's go over a few little tips that you can do that. Here are some conversation starters for you. Mental health affects how we all think, how we feel, and how we act. Mental health can change how we connect with others or see ourselves. Mental health can change how we handle our stress, our day-to-day life, changes that happen in our life, or other life situations. Mental health is important for how we all learn, how our brains grow, and how we explore the world around us. Mental health is an important part of everyone's health. When we all have good mental health, we can cope better with stress. When we have poor mental health, we might have a harder time feeling good about ourselves. Mental health changes just like our physical health can. So we shouldn't ignore problems. Even if you are diagnosed with a mental health condition, they're treatable, and you and your child are not alone, and support is available. There's always help available, and that is what we want you and your families to know, is that traveling this journey is not a lonely one. And once we start to reach out for help and have these conversations, that is when the real change can begin to happen. So how do you know if you should reach out for support for your child? There are many difficult parts of parenting, and one of them is knowing what kind of behaviors are usual for the stage of development that a child is in. And if the child has gone beyond that, it may benefit from further support. So signs and symptoms change over time and may change how a child plays with their siblings or their friends, or even with you or at school, how they learn, how they speak, how they act, and how they handle their emotions. Symptoms often begin in early childhood, which is from birth to age 5, but some can begin during the teenage years as well. Some signs to keep an eye out for are overwhelming to the point that normal stressors are interfering with everyday life. Your child is having difficulty at home or school or with their peers or family. They're having trouble with eating or sleeping too much or too little. They're having a hard time in situations that they were able to manage before. And those are just some examples. Some things to consider or keep a log of if you're noticing some of those signs or behaviors. How long have these things been happening? Have they been happening for days, weeks, or months? How frequently do they occur? Several times a day, once a day, or a few times a week? How intense do these behaviors become? Are they annoying? Are they upsetting? Or are they very disruptive for the day-to-day or family life? Has this child ever experienced or witnessed a traumatic event? Death, accident, illness, changes in family? Are they watching a lot of news coverage about the war currently? We've all lived through the COVID-19 pandemic. Have they lost a family member to illness in the middle of the pandemic? These are all things that can affect a child. And if you're not sure, let's sit down and have a conversation with your child about what could be bothering them. And if they don't really want to talk, you can sit down and maybe ask them to draw, or, what's bothering you today? And some other good ways to start these conversations are through books as well. There are lots of really great books that you can talk about your child's mental health with them, about emotions and things like that. And you can talk to the librarian here at your local branch, and they can suggest some really wonderful books to do that. It's important to remember that it's okay for all of us to have support, not only when we're struggling, but also when our life seems to be doing well too, because mental health is about overall well-being, not just when things are difficult. This is an important factor when it comes to breaking down the stigma surrounding mental health. It's not just when we're sick. It's when we're healthy too, and we need to be taking care of ourselves all the time. It's overall well-being. So just something to consider when you're thinking about your mental health and your child's mental health as well. Some more information about crisis services here on the right, and when to seek help and seeking professional help. Those links are straight to fact sheets on our website. and can be found in our family resource kit as well. And those would be really helpful for you if you're unsure about how to start the process to seek help and support for your child, or who to talk to, and of course, where to reach out for crisis services if your child or anyone you know is in the midst of a mental health crisis. So where should you reach out for support? Some people aren't sure where to start first. We do recommend that you could start by talking with your friends and family members if you feel comfortable doing so. They might have some good suggestions or know someone that they're already connecting with. If they have a child that is receiving support and services. If you aren't comfortable doing that, you could start by talking to your child's teacher or a school counselor or a school social worker, or even a spiritual counselor if that's something that you benefit from. If you don't want to start there, or you want to do both, you can even start by talking with your child's pediatrician or your family physician. Your child's pediatrician can recommend some supports in your local community for you. You can even call the number on your back of insurance card. A lot of folks aren't aware that they can do that, and they connect you with therapy services for your child. But if you want some more specific recommendations, you can start with your pediatrician and talk to them about what you're seeing at home, the behaviors that you're seeing at home, and they might have a good connection for somebody that you can start receiving support from for your child that way. Another point here is that sometimes we all can struggle for reaching out for support because of the fear of what this may mean for your child or your family. Because we're so concerned, or can be concerned, about what others may think about your child, or how you're raising your child. And it's important that when we're reaching out for support, that we find treatments and support from providers who are sensitive to our beliefs and our values. And you're left feeling respected and able to ask questions and advocate for your child and advocate for your family, so that you can assist in the process of supporting your child. It's important that you are able to step over the stigma surrounding mental health and speak up for your child, so that you can get them the support that they need as well. And the next thought here is that early intervention is crucial and an important tool for recovery. If you feel that your child would benefit from mental health support, please reach out for help now. Many children and adults go a long time between developing a mental health challenge and receiving an appropriate support. When, for example, anxiety, which is just one of many mental health challenges, often develops in childhood or as a teenager, is easily recognized and treated. And when it's left untreated, anxiety can lead to the onset of many other mental health challenges in later life. And there's so much support that can be offered as a child to help prevent those later in life challenges. So if you feel like your child could benefit from support and treatment, please reach out now for support. Early intervention is so crucial. Just reach out and talk to somebody now. So how can you support your child's mental health at home? Like I mentioned, speak up and reach out for support when your child isn't feeling themselves. Be open-minded and listen to your child when they're willing to talk to you, because they'll look to you for support and reassurance. Try not to downplay how they're feeling. Ask open-ended questions. Why are you feeling that way? What made you feel that way? I'm sorry that this happened. Can you tell me more? Try to keep those open-ended questions and be reassuring to them, and reassure them that we can find them support to help. And be a role model. Practice self-care strategies at home. Encourage your child to do so, and together as a family. And if you think that you would benefit from support and treatment, that's something that you could reach out for too, and encourage your child that, this is a good step. I can benefit from it. So can you. We can do this together. as a family, it's okay to take steps in taking care of our mental health, just like we do our physical health. Some self-care strategies for you to practice as a family at home, talking about and labeling emotions. There's plenty of books at the library that you could check out to start that conversation. Practicing gratitude. You can, for example, put a jar at home and write down something you're grateful for every day in that jar. And at the end of the month, spend some time going over what you were grateful for that month. Practicing self-affirmations at home. There's lots of really cool opportunities, and we'll have a project coming out later in May that is available for families to use, and really excited about that. Prioritizing exercise, whatever that looks like for you. Family walks, going to the pool to swim, lots of fun there. Creating following routines, getting on a good routine, it's good for everybody. Practicing relaxation and coping skills, deep breathing, going to bed at a good time, lots of free apps and things like that online on your phone, tablets, things like that. Making time for quality relationships, spending time with one another, such a good self-care practice. Following a healthy diet. It's good to take care of your physical health just as it is your mental health. If we're not feeding our brains properly, our mental health will suffer as well. Taking good breaks, putting down, taking a good break in the workday if you need to do that, putting down screens and taking a break, it's good for our brains. Having fun together, remembering to do that, especially if you're, in the middle of a stressful time, trying new things together. Those are just some tips, and there's more strategies you can find on our website as well, or find ideas online as well. And there's a resource that I have linked there from Mental Health America for adults to learn more about how important it is to prioritize self-care for yourself, because we can't pour from an empty cup to take care of anybody else. So it's really important for us to do that and be a role model for our kids. So we have a lot of resources available on our website, and some of the ones I want to go over for you are our family resource kit. We have that available in English and Spanish. Each version is exactly the same, except they're in 2 different languages. That resource kit is 23 fact sheets on the most common mental health challenges that children struggle with. There's also fact sheets in there on what you should do if you find yourself in the middle of a crisis with a child. And how to find support in that situation, where to go to find support, how to reach out for support for your child, how to seek professional care, school services. So if you are navigating that territory and setting up an IEP or 504 plan for your child, there's some information in there. Anxiety, depression, eating disorders, suicide and LGBTQ youth, just some to name a few, packed full of really great information in that family resource kit. Really encourage you to check it out. Even if you don't feel like you'll need it for yourself, it's a great tool to have in case you know somebody that is looking for mental health resources. Put a link there for our downloads and resources page. There's full of other resources for you to use, some activity sheets that you can download and print to use with your family. We also have a brand new resource page on our website. It's a resources by county directory. So you can find some mental health or community resources or school resources sorted out by county. And I'll go over a few on the next slide for Prince George's County specifically. But if you have family members or anybody else across the state of Maryland, you can send them there to find some resources that would benefit them. We have telemental health tip sheets. These were created right around the beginning of the COVID-19 pandemic to help families and teens and children navigate the space of telehealth and behavioral health, and using that platform for their behavioral health visits. They're currently being revised along with the creation of new sheets that will be available and ready for public viewing in the end of June, July of this year, but you can still see the current versions on our website now. They are helpful for helping you understand that if you are beginning to use telehealth and for your behavioral health visits. And then we'll have some other resources coming out soon. In April, we'll be releasing mental health book lists for children, infants through teens, and that will be available on our website. We'll be sharing it with the library as well, so that they can have some of those books available during Awareness Week, Children's Mental Health Awareness Week, which is May 1st through the 7th this year. And then in May, as I mentioned before, we'll be releasing a project that is being done with the Mind Resilience Committee with the state for family self-affirmation resources to practice that at home and also in the classroom. So we're really excited about that. So as I mentioned, we do have that resources by county page on our website, and I did go ahead and put some main resources here for you to see. If you're experiencing a mental health crisis, or your child is, or having thoughts of suicide, or having problems with alcohol or drugs, you can connect free to confidential support to 211. So you would call 211 and press 1, or you can text your zip code to 898-211. And you can receive support that way. We at the Mental Health Association are a statewide education and advocacy agency, and we provide community outreach and education to all Marylanders of all ages to improve understanding of behavioral health. And we provide free resources to Marylanders to use and distribute to learn more about mental health conditions. So you can find more information about the resources that we have and events that we have going on at www.mhamd.org. And then the Maryland Coalition of Families helps families who care for someone with behavioral health needs. Using personal experience, they connect and support and empower Maryland's families. Their staff provide one-to-one support to parents and caregivers of young people with behavioral health issues, anyone who cares for someone with a substance use or gambling issue, and families with youth involved in the Department of Juvenile Services. So if you would like more information about the services they offer to Marylanders, you can visit their website at www.mdcoalition.org. So those are some resources available for you from our organization and crisis services, and then some specific resources in your county that will be beneficial for you to know about. Our community crisis services, and their phone number is listed there. The Prince George's County Crisis Response System and their phone number. The Family Crisis Center of Prince George's County, which is for domestic violence. And then of course, the Prince George's County Health Department and their phone number there. All of this is listed on our resources by county page. So if you need to see it again, you can find it there. We would love for you to stay in touch with us. We do share a lot of resources and updates about our campaign on our website, which I did mention at the beginning, which is www.childrensmentalhealthmatters.org. But you can follow us on social media, on Facebook, Instagram, or Twitter, and you can see our handles there. You can sign up for newsletter updates. We send out newsletters pretty periodically, so you can go to our website and scroll down midway on the homepage and sign up for our newsletters there. And if you would like to contact me or our co-coordinator, Tara Wetherell from Maryland Coalition of Families, if you have any questions about the services either of our organizations offer, I encourage you to do so. You can see our email addresses here on that slide. And thank you so much. I hope that you found this information beneficial and that you find time to take an evaluation of your mental health, your family's mental health, and that you don't hesitate to reach out for support if you or your child are struggling right now. And remember that Children's Mental Health Awareness Week is May 1st through the 7th. And if you need any resources or books to talk to your children about their mental health, your librarian at your local branch would be more than happy to connect you with some good books to start that conversation. Thanks so much. And if you have any questions about mental health, your children's mental health, you can reach out to me. Thanks so much.